I'm now pleased to introduce Dr. Sarah Moore. Dr. Moore is a professor of neurology and neurosurgery at The Ohio State University in the Department of Veterinary Clinical Sciences and holds the Wolfe Associates endowed professorship in canine and comparative medicine. Dr. Moore completed her residency in neurology and neurosurgery at North Carolina State University in 2009 and a postdoctoral research fellowship in neuroinflammation and spinal cord injury at The Ohio State University in 2011. Her research focuses on the management of acute spinal cord injury in dogs, and her clinical interests include spinal surgery and developing new strategies for managing neuropathic pain in veterinary patients. As a reminder, all viewers can post questions and comments in the chat during the presentation. Dr. Moore will answer questions from the audience as part of her live Q&A after the talk. Also, for our veterinary audience attending, Dr. Moore's talk today is eligible for CE credit. So all attendees will receive 1 hour of RACE-approved CE credit for attending today. We will send an email after the event with instructions on how to request a certificate of attendance. Please join me in welcoming Dr. Sarah Moore.
Thank you for that very kind introduction, and good afternoon to everyone. This afternoon, I am going to be providing an update on some management aspects related to canine acute intervertebral disc extrusion. And really, the goal of this lecture, from my perspective, is to use the next 40 minutes or so to provide some background on some aspects of the diagnosis and management of intervertebral disc disease, as well as provide a quick review of the natural history of the condition, talk about the role of disc mineralization in the clinical presentation of intervertebral disc extrusion, to provide an update on some management recommendations and expected outcomes, and then to spend a little bit of time talking about assessing risk for intervertebral disc disease, really in the context of various clinical and demographic features, as well as touch a little bit on what we know and what we're starting to learn more about the genetics of the condition, and what's new and up and coming on the preventative front for this disease. So intervertebral disc disease intervertebral disc degeneration is kind of an umbrella term that is typically used to describe two actually very different processes in some ways. And we term those Hansen type 1 and Hansen type 2 intervertebral disc degeneration. Hansen type 1 intervertebral disc disease manifests as mineralization of the nucleus pulposus, which is that kind of normal gelatinous center of the intervertebral disc, and then subsequent altered biomechanics of the disc itself, which lead to fissures or tears in the annular fibrosis, or that sort of outer fibrous ring of the disc. Mineralization or mineralized nucleus pulposus can be acutely extruded through those fissures in the annulus fibrosis. And that NP material can actually rupture up into the vertebral canal, causing compression and contusion of the spinal cord and the nerve roots. As most of us who do some small animal medicine are probably well aware, chondrodystrophic breeds are most commonly affected with Hansen type 1 IVDD, and the incidence is very high in certain breeds such as the Dachshund, Beagle, and French Bulldog. Interestingly, kind of as an aside, and some folks maybe have this sentiment as well, as they manage some of these dogs in clinic, it used to be that historically we really thought of the Dachshund as the poster child for this condition. But with the rising popularity of the French Bulldog, I actually think that has now made them the most common dog to present with type 1 IVDD, and in my practice at least, we do see quite a lot of Frenchies these days with this disease. In contrast to Hansen type 1 intervertebral disc disease, Hansen type 2 IVDD is manifest primarily as what we call protrusion of the annulus fibrosis upward. And so as those annular fibers stretch and weaken, the nucleus pulposus is also undergoing degeneration or dehydration in dogs with this type of disc degeneration. But it's not mineralized, so the NP is not mineralized typically in these dogs. And so that annulus and in some part the nucleus as well will bulge up and start to put pressure on, again, spinal cord and nerve roots. But it tends to be more of a chronic, gradually progressive process. And we typically see type 2 intervertebral disc disease in large breed dogs, often geriatric in age. And this condition is often very multifocal in nature, with many times multiple discs in the cervical, thoracic, and lumbar spine affected simultaneously. Today's presentation is actually going to focus on Hansen type 1 intervertebral disc degeneration, which is, again, type of degeneration we talked about involving that mineralization of the nucleus pulposus. So just wanted to set the stage that moving forward, when we talk about intervertebral disc disease, really today what we're referring to is Hansen type 1 intervertebral disc disease. So when we talk about Hansen type 1 intervertebral disc disease, degeneration and subsequent extrusion of disc material, it's an incredibly common condition of dogs, where a recent survey on practice patterns in the management of this condition actually suggested that anywhere between 20 and 30,000 cases of type 1 intervertebral disc disease are managed every year by veterinary neurologists just in North America alone. So incredible incidence in our veterinary population. That number is large, but it is actually likely an underestimation of the condition, because we know that many, many more cases actually are managed by family veterinarians in the general practice setting and may never come to see a neurologist. So hard to estimate what the true number is there, but we suspect it's actually much more than that 20 to 30,000 cases a year. As many of you are probably familiar with, dogs with acute intervertebral disc extrusions present with a spectrum of neurologic deficits caused by a combination of compression and contusion of the spinal cord, usually secondary to this very sudden, almost explosive sometimes, extrusion of degenerated and calcified nucleus pulposus into the intervertebral canal through those tears in the annulus fibrosis that can develop. Severity of clinical injury spans a continuum from sometimes just paraspinal hyperesthesia or back pain, up to paraplegia with or without loss of what we call deep pain perception, or sort of sensory function of the limbs that are involved. When these patients lose deep pain perception, they're often termed deep pain negative, which is the most severe type of injury that we see with intervertebral disc extrusion. In addition to being one of the most common neurologic conditions that's managed in veterinary medicine, Hansen type 1 intervertebral disc disease is also probably one of the oldest described veterinary neurologic conditions. Actually, the first description of a clinical presentation of a dog with IVDE is credited to Dexler, who described the condition in the late 1800s as a condition of paralysis in dogs caused by compression of the spinal cord from abnormalities of the intervertebral disc. At that time, he was not clear that this was actually a disc rupture, so he used the term neoformations to describe what he saw histopathologically in these dogs. But in the 1950s, kind of simultaneously, Olson and Hansen both published some in-depth investigations into the syndrome, and both supported the fact that these neoformations were actually disc herniations. Hansen's report on the condition actually further highlighted that there were at that point 3 breeds that seemed to be at apparently high risk for the condition. And the ones that he called out in his work were actually the French Bulldog, the Dachshund, and the Pekingese. In the 1950s, 60s, and 70s, really we started to develop some recommendations related to treatment of the condition, really at that stage mostly focusing on medical management, even for dogs with very severe injuries. However, suboptimal outcomes were achieved, again, in a lot of those dogs with very severe clinical signs, and so surgical approaches to treat the condition began to be explored and then ultimately perfected. In the 1990s, brought about a widespread availability of cross-sectional imaging, so computed tomography at that stage of the game was the most common diagnostic imaging used in the diagnosis of intervertebral disc extrusion. And that really helped to improve diagnostic accuracy and surgical planning and ultimately patient outcomes as well. And then in the early 2000s, MRI became more widely available to us in veterinary medicine and has, for some scenarios, actually become our diagnostic approach of choice. And we'll talk a bit more about that later on in the lecture. But perhaps one of the most exciting recent developments, and again, we'll talk a bit more about this as well on our timeline here, is that there has been, over the last 1 to 2 decades, some identification of some of the genetic underpinnings of the condition, which will likely pave the way for future advances in both the prevention and in the treatment of the condition. So why does degeneration of the intervertebral disc happen in the first place? So in many ways, this is kind of a $1,000,000 question because, of course, if we understood perfectly what the pathogenesis of this condition was, we might have some approaches to prevent and maybe more effectively treat it as it develops at this point. So we don't entirely understand the entire pathogenesis, but we do know a lot about the mechanisms of degeneration. And what we know so far will likely help us to continue to identify targets for treatment of the condition. So we've got a good understanding of several key steps in the disc degeneration process. First, a major feature in various species that undergo major or significant disc degeneration is the loss of a cell population called notochordal cells. And notochordal cells are really interesting. So they act as an embryonic stem cell within the nucleus pulposus, even in the adult animal, and they act to protect the NP from degradation and apoptosis. Loss of notochordal cells within the nucleus pulposus has been associated with an imbalance of matrix turnover and catabolism of the disc. These notochordal cells, when they are lost, are replaced by chondrocyte-like cells, which work to alter the makeup of the disc and to alter the biomechanical function of the disc as well. One of the sort of secondary steps that we see in the process of disc degeneration is that proteoglycan content within the disc gradually declines, both with time and as the animal ages. This is important because proteoglycans play an important role in that sort of cushioning function that we think of as being so important as the role of the intervertebral disc between the vertebrae. So that nucleus pulposus, that hydrated jelly center of the disc, really is important as a cushion between the bones of the spine. Less proteoglycan content leads to altered biomechanics of the disc, which can then further that degeneration process. Additionally, as degeneration of the disc progresses, it becomes more fibrous with increased collagen deposition. Again, just kind of further altering that biomechanics of the disc, reducing its ability to act as a shock absorber. And as these changes continue to progress, what we often see happening is that there are clefts or cracks that begin to form within that outer annulus fibrosus. And the cartilage end plates of the vertebrae, which are present on either side of the intervertebral disc, can become sclerotic and calcified as well. Those cartilage end plates actually are very important because they are highly porous in health, and because the disc itself is very minimally vascular. Those pores within the cartilage end plates are important for diffusion of nutrients into the intervertebral disc. As those cartilage end plates become sclerotic, we see reduced porosity and reduced perfusion of nutrients to the disc, which can further lead to damage and degeneration. And then as a relatively late change in the degeneration process, we see upregulation of pro-inflammatory responses and other types of changes that lead to increased expression of things like vascular endothelial growth factor, or VEGF, and nerve growth factor. Those types of changes work to recruit neovascularizations, or new blood vessels, as well as nerve endings into the disc itself, and they can lead to disc-associated pain. And then finally, and really commonly in dogs with Hansen type 1 intervertebral disc disease, this cleft in the annulus can continue to widen, and ultimately they can allow for rupture of that nucleus pulposus into the vertebral canal, and then the resulting clinical signs that we tend to associate in our dogs with the condition. Okay, so we've talked a little bit at this point about why disc degeneration happens, and now we're going to talk a little bit about making the diagnosis. So how do we make a diagnosis of intervertebral disc extrusion? Well, most of us who practice small animal medicine are probably pretty good at recognizing the usual suspects, so to speak, related to this condition, which actually don't look at all like these dogs that are on the right-hand side of the screen here, although maybe dog number 5, our basset hound, might be on our list of potential subjects for, kind of typical concern for intervertebral disc disease. Although most of the time, our patients with intervertebral disc extrusion are going to look a little bit more like this. If we watch the video here, we have Andy, who is a 7-year-old male castrated dachshund. He presents to us for some issues with discomfort. His owner thinks his back is sore. She's noticed him having some trouble jumping on and off the couch, and obviously some difficulty walking, as we can see in the video here. Andy looks to be pretty normal in the thoracic limbs if we watch him move. Obviously, he's got some ataxia or some inconsistent foot placement in the pelvic limbs and some weakness as well. He has some proprioceptive deficits that we can see here in the video. And ultimately, as we watch the rest of his neurologic exam, it becomes pretty clear to us that Andy has a T3 to L3 myelopathy. So, for many of us that are small animal practitioners, we know that an acute, painful T3 to L3 myelopathy in a dachshund is typically going to be presumed to be an intervertebral disc extrusion until proven otherwise. Not to suggest that dachshunds can't have other problems, but very, very common presentation in the small animal veterinary clinic. So, beyond recognizing that kind of typical clinical signalment, breed, presentation, how are we going to make a diagnosis of intervertebral disc disease? So we can certainly use other features beyond just clinical presentation to help us narrow down our differential list for these patients. This is actually a radiograph from Andy, who you saw in the previous video. And as you can see here, this dog actually has several intervertebral disc spaces that show some evidence of mineralization of the nucleus pulposus. So they are going to be most notable if you want to focus your attention at the L6-7, L4-5, and T12, T13 intervertebral disc spaces. And I can actually provide some additional information about this case, and then ultimately Andy ended up having some advanced imaging of his spine beyond just plain radiographs that showed that mineralized disc that we can see here at T12-13 was actually ruptured up into the spinal canal and causing some spinal cord compression. And I think if you really, really look carefully at that disc space on the radiograph here, you can kind of get a sense that it looks like there is some mineralized material that is protruding up into the spinal canal. So in this case, we might have a strong suspicion of an intervertebral disc extrusion based on plain radiographs, although we don't always have the luxury of necessarily seeing that on a plain film. So what do we know about plain radiographs as a diagnostic tool for intervertebral disc disease? So that's actually a question we get a lot, both from owners and from family veterinarians who are managing these cases in the clinical setting, is what actually is the diagnostic utility of a plain radiograph for dogs with intervertebral disc extrusion? And I realize I just showed you an example where I pointed out that I thought I probably could tell based on a radiograph where the problem might actually be. But the short answer is that honestly, the diagnostic utility of a plain radiograph for intervertebral disc disease is relatively low. Where both the sensitivity and specificity of diagnosing an extrusion at any particular site based on radiographic changes is not high. An example of this I'll show you here on the slide is a radiograph of a 3-year-old dog who came in to see us with a sudden onset of neck pain. She had 2 discs. If we look at the radiographs here that show some evidence of radiographic mineralization, so looks like her C4-5 and C5-6 intervertebral discs have some evidence of mineralization of the NP in situ or living where it should normally live radiographically. But I will tell you that this dog went on to have some advanced imaging of her neck, and we determined that she did have a disc extrusion, but it was actually at C2-3, which radiographically does not look like the most prime contender based on these radiographs. So it's important to know that from a diagnostic perspective, plain radiographs have pretty low sensitivity and specificity in terms of diagnosing an extruded disc for surgical planning. But radiographs can be very helpful in our diagnostic approach to this condition in that while they aren't diagnostic for a disc extrusion itself in most cases, they can be extremely helpful in ruling out other conditions that cause a painful myelopathy, so including things like lytic bone tumors or discus spondylitis, where we often see radiographic changes in those conditions. The other thing that plain radiographs can actually be useful for is in looking, again, for evidence of mineralized discs in situ, as well as looking for changes in the shape and opacity of the vertebral foramen, which may help us assess a little bit more how concerned we might be about an intervertebral disc extrusion. And they absolutely can give us some information about risk. So what level of risk does this patient have to actually have an intervertebral disc extrusion? And so we'll talk a little bit about that as well. So what does disc mineralization mean? Well, we all have seen plenty of radiographs of chondrodystrophic breeds that have multifocal intervertebral disc degeneration, which is evidenced by calcification or mineralization on the radiographs. And I think a lot of us have seen the evidence of those on, maybe an abdominal film that you took for completely other reasons. So we see them as asymptomatic changes all the time. So when we're looking at evidence of disc mineralization on a radiograph for a dog that presents to us with neck or back pain, what does that really tell us? Or what does that tell us for the dog that presents to us for complete other problems? And we notice that incidentally. Well, we do know that mineralization of the nucleus pulposus starts to occur histopathologically at an extremely young age. So in chondrodystrophic dogs as young as 10 weeks of age, we actually can sometimes demonstrate histopathologically that there's evidence of mineralization of the nucleus pulposus. Radiographically, we start to see an increased prevalence of mineralization of discs in these breeds between about 12 and 18 months of age, where disc mineralization is present in as much as 57% of adult chondrodystrophic dogs eventually. Interestingly, we also know that individual calcifications or mineralizations may actually disappear radiographically as dogs age. So we can follow these dogs longitudinally and see at some points in life they have overt radiographic mineralization of their discs, and that may go away on plain radiographs over time. Interestingly, though, if we go on to then look at those aged discs histopathologically, we do still see persistent mineralization when we examine them. So it's not really that the disc recovers or becomes more healthy. It's not a marker of improvement of disc health, but rather it probably reflects resorption of that mineralized material that may occur secondary to an inflammatory response targeted at that mineralized NP. Importantly, as I said before, it's really not an indicator that the disc has returned to normal. More likely, it represents a very late stage change in the degenerative process for those patients. We also know that the more mineralized discs a dog has, the higher their risk for disc herniation, where one study showed that dogs with calcification status of greater than 5 intervertebral discs had a relative risk almost 15 times higher for disc extrusion than those with less than 5 mineralized discs. And what's really interesting, though, to me, is that in dogs with mineralized discs that are apparent on imaging, disc extrusions seem to occur at a similar rate for both mineralized and non-radiographically mineralized discs. Similar to the example we just looked at before, where we had several mineralized discs, none of which were the actual ruptured disc on advanced diagnostic. So it seems that disc mineralization is perhaps a sentinel for the degenerative process, but it's not really the underlying cause or primary pathology per se. So as we mentioned before, plain radiographs can be helpful in ruling out other differentials beyond intervertebral disc extrusion and in raising the index of suspicion for IVDE, but they're typically not going to be diagnostic in and of themselves for the condition, and they certainly don't provide a cross-sectional component, which is required for surgical planning. Computed tomography is a cross-sectional imaging modality that we frequently use for the diagnosis of intervertebral disc extrusion. And I've got here on the slide that sort of upper set of images reflects changes we might see radiographically. Right below it is a CT image actually from the same patient. So we can see that radiographic disc mineralization, which in this case actually did correspond to a disc extrusion in this patient. So CT, depending on the study that you look at, has anywhere between an 80 and 100% diagnostic sensitivity for the diagnosis of mineralized thoracolumbar intervertebral disc disease. So patients that have mineralized disc extrusions, CT is very good at helping us to demonstrate those. However, the diagnostic sensitivity and accuracy is as low as about 57% in the diagnosis of other disease processes of the vertebral column. Additionally, CT doesn't assist us with prognostication beyond what we can see in the clinical exam because it doesn't provide good detail of the spinal cord itself. So we are not able to appreciate things like extensive concussive injury to the cord or evidence of secondary injuries that can occur after compression, such as progressive myelomalacia. So we don't tend to recognize those on CT, but clearly for the patient, they can be very important in terms of setting expectations for outcome. But for the diagnosis of uncomplicated mineralized intervertebral disc extrusion, CT is absolutely sufficient in the majority of cases. The images are fast to acquire with CT, and in most practices, the cost of a CT is going to be about half the cost of an MRI. In comparison, MRI has a very high diagnostic sensitivity for both intervertebral disc herniations, both mineralized and non-mineralized, as well as other pathology of the vertebral column. And we've got an example of a patient with an MRI at the bottom of the screen, diagnosed with an acute intervertebral disc extrusion as well. And in addition to demonstration of various pathologies of the vertebral column, including disc extrusions, MRI has the added benefit that it provides detailed images of the spinal cord itself, such that we can look at intramedullary lesions such as progressive myelomalacia, so we can identify those to help us aid in prognostic information as well as assist us with treatment planning and ultimately what outcomes we might expect for the patient. So we've talked a little bit about underlying pathogenesis of the disease. We've talked about diagnosis via a couple of different imaging modalities. We're going to talk very briefly about treatment considerations. I think, again, most of us that manage this condition in clinic are acutely aware that we have both medical and surgical management options. Medical management typically is going to entail crate rest and pain medications, while surgical management typically will consist of surgery to perform a laminectomy with removal of that compressive disc material from around the spinal cord. Surgical management is typically recommended for more severe cases, so dogs with more severe neurologic deficits. And the table that I have here on the screen summarizes the literature related to expected outcomes for medical and surgical management of dogs with various degrees of neurologic dysfunction secondary to intervertebral disc extrusion, where we tend to see that patients with just back pain or who have mild deficits, ambulatory paraparesis, actually tend to have a pretty similarly favorable outcome, whether they are treated medically or surgically. It is important to note that there are some dogs actually that present just with spinal pain as their only clinical sign that do go on to require surgery. So they have oftentimes a very lateral extrusion of disc material that puts pressure on their nerve root. And some of those dogs may need surgery even if their deficits are mild. As you can see here as well, though, as dogs progress to more severe clinical signs, non-ambulatory paraparesis, what the literature suggests is that about 81% of those dogs will still recover with medical management. The recovery rate's a bit higher with surgery, but that recovery with medical management tends to be less complete than for dogs that undergo surgery. We tend to start to recommend surgery for our dogs that are non-ambulatory. Because we just tend to see that they have a bit quicker and more robust recovery. For dogs that are paraplegic with deep pain perception intact, about 60% will recover with medical management, while 93% will recover with surgery. So again, at that stage of the game, we do start to expect an improved outcome with surgical decompression. So that's where those recommendations come from. But it is important to recognize that for owners that are not able to pursue surgery, even for dogs that are non-ambulatory or who are paraplegic, there is still a better than 50% chance, as long as they still have deep pain sensation, that they may get better with medical management. So it can absolutely be worth a try to manage those medically if the owner is not able to pursue surgery for their pet. So when it comes to management of intervertebral disc extrusion, there are a host of different topics from which the veterinary community could benefit from future studies, including everything from ideal duration of medical management and crate rest to various measures to prevent secondary complications of severe disc extrusion, such as progressive myelomalacia. I recently was very privileged to serve as a co-chair for the ACVIM consensus panel on the management of acute canine intervertebral disc extrusion. And one of the things our panel really identified as an important area for future study, in addition to all of the other important things we have listed here, is that we really are in need of some studies that focus on prevention of the condition. And so I wanted to spend the last couple of minutes here sort of talking about what we know about assessing patient risk, what we know about underlying genetics, really because those may actually set the stage for us in the future to move forward with some preventative measures. So we know that there are an assortment of patient-level factors that may influence the risk of intervertebral disc extrusion. And those include things like being overweight, potentially, having a high body condition score. Some of these things like conformational changes, things like activity level or types of activity that patients may do on a daily basis, and of course things like genetics may factor in as well. And some of these things have already been studied as risk factors, at least to some extent, in the clinical setting. And we can discuss those a little bit in the context of how they actually do impact the risk of developing intervertebral disc extrusion. So the role of weight or body condition score is one that comes up a lot in the clinical setting, and I certainly have found myself dishing out the advice to owners that they should follow, in terms of keeping their dachshund or Frenchie on the lean side to help reduce back issues. But interestingly, the literature on this matter is actually kind of mixed. So there are a couple of studies that have looked at this, and some have found an impact of body weight. Some have found that there was no difference in body weight or body condition score between chondrodystrophic dogs that did and did not develop intervertebral disc extrusions. The study here on the screen, that Packer et al. Study, did actually find an influence or a potential association between body condition score, which we kind of use in VetMed as a surrogate for BMI, and the risk of disc extrusion, among some other conformational things that they found. And we'll go on to talk about that study just a little bit more. But at least as of now, I'd say the literature is a little bit mixed on the role of body weight and the influence on risk for disc extrusion. What we do know, though, is that patients that are heavier, that have higher body condition scores, do have a slower recovery after disc extrusion. So no matter what, probably still a good reason to keep your chondrodystrophic dog a bit on the lean side. If they do have a disc issue, it's likely to help them from a recovery standpoint. I mentioned already the Packer et al. Study and their findings related to the role of increased body weight obesity. But one of the other things this study looked at addresses a kind of a common question that people have about risk of disc extrusion, and that's the association between that sort of long back, short leg conformation and what that does as a predisposing factor for type 1 disc disease. And that kind of relationship between the longer back and the risk of disc extrusion has been noted as far back as Hansen in the 50s. So kind of a common sentiment that there may be an association there. The study I'm highlighting here on the screen is actually that same study we just mentioned related to body condition score. But these folks actually also looked at a couple of different measurements related to body conformation. So they looked at the length of the back and the height of the withers, and looked at a ratio between those, and they found that dogs were a little bit more toward that 1-to-1 ratio, had about half the risk of intervertebral disc extrusion compared to dogs that had a longer back relative to their withers height. So potentially some suggestion, at least from this study, that the longer you are and the shorter your legs, the higher risk you may be for intervertebral disc extrusion. They also did, again, find an impact or potential impact of mild to moderate obesity, particularly when that was coupled with a small skeletal size. So being short and chubby was not a great thing when it comes to disc health. But it's important to mention here, and you may be wondering this yourself, that a lot of these long back dogs are in fact going to just inherently be at risk because of their breed, but this study actually did control for breed. So they were able to take that out as a confounding factor. So it does seem that even within chondrodystrophic long back breeds, the longer your back and the shorter your legs, the higher risk you could be for disc extrusion. So based on the Packer conformational study, we know that it seems to be that there is some association between conformation as a factor for risk of intervertebral disc extrusion, but we also know it's not the only factor. So some moderately shaped breeds have a high incidence of intervertebral disc extrusion. So breeds like the Jack Russell Terrier, the Cocker Spaniel, the Cavalier King Charles Spaniel, they're all breeds that we do see quite a lot of intervertebral disc disease in, but they are nowhere near as long and low as the dachshund. So we know that there have to be other factors besides just conformation itself that play into this risk. So this is going to bring us to what I kind of wanted to finish the talk with today, which is talking a little bit about the discussion of genetic risk factors for intervertebral disc disease. It's definitely a topic that's become kind of a hot topic over the last several years, really starting with the identification of the genetics that underlie initially chondrodystrophy in 2009, and then followed particularly by the publication of this paper on the screen here by Brown et al. In 2017, which demonstrated that overexpression of an FGF4 retrogene is an important risk factor for the development of intervertebral disc extrusion. And there have been some follow-up papers that have looked at that a little more carefully as well. But the take-home message really is that overexpression of a protein called fibroblastic growth factor 4, or FGF4, which happens via an insertion of an FGF4 retrogene on canine chromosome 12 and 18, appears to have a broad influence on limb length, with positive selection induced in some breeds due to the influence of a chondrodystrophic phenotype. So people like these long-backed, short-legged dogs, and we have bred for them over time. Interestingly, overexpression of FGF4 secondary to retrogene insertion on chromosome 12 has also been associated with premature degeneration of the intervertebral disc. That FGF4 insertion, which also can reside on chromosome 18, has been associated with chondrodysplasia, but not intervertebral disc degeneration. So this insertion specifically of the FGF4 retrogene on canine chromosome 12 actually can result in as much as a 20-fold increase in FGF4 expression compared to dogs without that retrogene insertion. But how does FGF4 overexpression lead to intervertebral disc disease? Well, there are some answers that remain to be fully defined at this point, but there are some really clear aspects of how this might occur. So first, FGF4 is a member of a family of proteins that interact with a set of tyrosine kinase receptors that are expressed predominantly in mesenchymal tissue. Most fibroblastic growth factor proteins, of which there actually are many, play an important role in embryonic development and organogenesis. And FGF4 is most highly expressed in a set of tissues such as embryonic ectoderm, lateral plate mesoderm, and the tail bud. And then later in embryonic development, FGF4 is also highly expressed in the developing limb bud, as well as somites that go on to form the vertebral column and the non-nucleus pulposus components of the intervertebral disc. So there are actually a variety of experimental models that look at what happens when you alter FGF4 expression, and they suggest that the protein actually has to be very tightly regulated in order for normal limb and vertebral development to occur. Interestingly, we haven't documented FGF4 expression in the nucleus pulposus of the disc during development, but we do know that fibroblastic growth factor signaling pathways are important in the differentiation of notochordal cells. And we know that mutual interaction between notochordal cells and vertebral bodies are very important in proper formation of the intervertebral disc. So it's probable that there are additional disease-modifying factors, environmental contributors, and also patient-level risks that contribute to the overall presentation of intervertebral disc disease across breeds. But we do know at this point that the presence of the canine chromosome 12 FGF4 retrogene alone is sufficient to cause loss of those normal notochordal cells within the disc and replacement of the nucleus pulposus by cartilaginous material in puppies even as young as 10 weeks of age or so. Also, the effect of that chromosome 12 FGF4 retrogene on disc degeneration appears to be dominant, as it is seen in dogs that are both homozygous and heterozygous for the insertion. And that image here on the screen actually shows a normal 10-week-old intervertebral disc in a dog that is homozygous negative for that FGF4 retrogene, and then on the right-hand side of the screen, a dog that's homozygous positive. And we can see that there is replacement of those foamy notochordal cells with predominantly chondrocyte-like cells. A process we discussed earlier is actually being really important, implicated in the mechanism of initiation of disc degeneration. So prospective data on the relative risk of intervertebral disc disease associated with this canine chromosome 12 FGF4 insertion are still to be collected, and the data actually can be a little bit difficult to sort out retrospectively because of the very high allele frequency within at-risk breeds. Also, the effect of gene dosage, whether you have one versus two copies of that retrogene, remain to be fully elucidated. And as we mentioned already, there likely are other genetic modifying factors, as well as conformational and environmental variables that still require to be, still need to be investigated. But it's important to note that because, note this because it is a question that we get more and more from breeders and owners at this point, is that since the allele frequency is so high amongst most chondrodystrophic dogs, breeding strategies that employ genetic testing for this retrogene need to be carefully explored before they're widely implemented, because attempts to radically eliminate this gene from the pool could potentially lead to selection bias for other non-desirable traits or diseases if we aren't really careful about how we approach it. So no doubt this is going to be focused work in the near future for researchers interested in this condition, and I'm hoping that in the next few years we'll know a little bit more about appropriate preventative breeding strategies. So this seems like a great place to stop, sort of ending on a note of future directions related to the genetics of intervertebral disc extrusion, really with an eye on how we might be able to ultimately prevent the condition altogether. So with that, I will stop and I'll open things up for a brief question and answer session. Thank you. Good afternoon. So we're going to go ahead and start the Q&A portion of the session here. So we've got time, probably about 5 minutes, to answer some questions that folks have put in the chat over the course of the presentation. And certainly, please feel free to add additional questions as we talk here. But I'm definitely seeing some themes with the questions that folks have so far, and a lot of them really seem to center around risk factors, some related to genetics and some related to other activity and environmental things. So we will try to go through a couple of those and see what we can answer. So this first question says, in Portuguese water dogs, we are seeing the CDDY mutations, but rarely seeing disc rupture expression. Do you have recommendations about the appropriate activities for dogs who are asymptomatic carriers? And I think this brings up a really interesting and really good point that we alluded a little bit to in the presentation today. But we know that there are genetic underpinnings to intervertebral disc degeneration in dogs, and some of those are necessary but may not always be sufficient. So there likely are going to be other either genetic modifying loci that may contribute to degeneration in certain breeds. There may be other environmental and activity related things that may contribute. And so not surprising in some ways that there are some breeds that seem to have a relatively high prevalence of that CFA12 FGF4 retrogene, but not a high prevalence of intervertebral disc disease. So, what other things may contribute to that? So some of the questions here that people have posed are things like agility, weave poles, dock diving, and whether any of those things have been associated directly with disc herniation in dogs. And it's kind of interesting because those are all really high impact activities, and you would think that they would be the types of activities that would increase your risk for intervertebral disc extrusion. Interestingly, there was a study conducted by a group out of Europe looking specifically at some of these high impact activities in dachshunds and how they related to risk of intervertebral disc disease. So this was a survey study, but it did require a veterinarian to have diagnosed the dog, and in this case they were all dachshunds with intervertebral disc disease. And that study actually found that the dogs that were very active, doing things like agility and very high-level sports, had a reduced risk of intervertebral disc extrusion. And so it does seem that for the otherwise healthy dog, being active, being fit, being an athlete probably is a reduced risk factor for disc degeneration. Now, tables turn a little bit, I think, once you have already a history of disc disease in a particular dog. Then we do want to be more careful about high impact activity. But on the whole, things like agility and dock diving in an otherwise healthy dog are not necessarily things that we would discourage just based on genotype of the dog. There's also a question here in the chat about managing breeding decisions for dogs that are homozygous or heterozygous for the FGF4 retrogene on chromosome 12. And that is a really loaded topic right now. So I don't know that we are necessarily in a place, at least at this stage, to be making strong breeding recommendations, particularly for some of our breeds that have an extremely high incidence of the mutation, because we really can run the risk of doing more harm than good if we start to very aggressively try to breed out that chromosome 12 FGF4 retrogene. So at least at this stage of the game, I'm not sure that we're ready to make those types of breeding recommendations, but lots of opportunities for future prospective studies that really do look at risk a little more carefully and may be able to help us develop some more targeted recommendations in that regard. I also see a question in here related to the role of hemivertebrae or other spinal deformities or sort of kinks in the vertebral column, and how those might factor into risk associated with intervertebral disc disease, which is another great question. It's actually kind of interesting again as well that, of the breeds that we tend to think of as being highest risk for type 1 intervertebral disc disease, for the most part, they don't tend to be breeds that we see a high incidence of hemivertebrae. So if you think about dachshunds, you think about beagles, we do occasionally see hemivertebrae in those breeds, but not commonly. Now, the exception to that rule is the French bulldog, where we do often see hemivertebrae. And the role between intervertebral disc disease, Hansen type 1 intervertebral disc disease, and hemivertebrae, I would say at this stage is not terribly well established. We do see it both conditions commonly in French bulldogs, and certainly hemivertebrae alter the biomechanics of the spine, so we can see changes in the disc related to that. But from a genetic perspective, at least at this stage of the game, I am not aware of a clear link between those two phenomenon. Looks like we maybe have time for one more question here. And I'm seeing in the chat someone asking about the incidence of spinal stroke versus extrusion, and diagnosis being made more acutely at the general vet's practice without access to MRI. So we know a lot about the incidence of acute intervertebral disc disease in dogs because we've done some surveys to really try to get at that. The incidence information we have about spinal stroke comes primarily from referral centers. And as you mentioned, some of those cases may actually never make it to a referral center. So it's a bit harder to answer, true prevalence or true incidence of spinal stroke. It is certainly much less common in our practice than is intervertebral disc extrusion, although it absolutely does happen, and certainly is a type of condition that we manage pretty routinely in the dog. So those are all great questions. Thanks to everyone for their time and attention. I really do appreciate it, and I'm hopeful that this presentation has sparked some interest in the thought process behind considering risk factors for intervertebral disc disease in dogs, and starting to think about the genetic underpinnings, and even more importantly, how we can really move forward with thinking about preventative strategies for this disease. So thank you very much.